Welcome to The Explainer. You know, artificial intelligence is changing pretty much everything. But what happens when it steps into one of the most trusted professions on the planet, nursing? Today, we're looking at how nurses are mastering AI, not by fighting it, but by building their entire strategy around one single, unshakable principle.
Okay, let's just jump right in with a scenario that's playing out in hospitals as we speak. An AI, which has been trained on millions of patient records, suggests a change to a care plan. It's logical, it's data-driven, it seems efficient. But if that plan is followed, who's on the hook for what happens next? The software company? The hospital? I mean, is it the algorithm itself?
For the nursing profession, the answer is crystal clear, totally consistent, and absolutely non-negotiable. It's the nurse. And this one principle, this is the bedrock for a profession-wide strategy to make sure that technology serves patients and clinicians, not the other way around.
So you gotta ask, how does a profession that's built on human judgment and personal accountability handle a tool that's built on pure data and probability? Well, instead of just letting new tech show up piece by piece, the nursing profession is meeting this whole challenge with one unified response.
And this right here, this is the key insight that's driving their whole strategy. Nursing leaders get it. AI is already in the classroom. Students are using it to study. It's already in the clinic, embedded in the software they use every day. So the choice isn't if they're going to use AI, it's how they're going to use it responsibly. By getting out ahead of it, they're giving real guidance instead of just leaving everyone to figure it out on their own. And this framework, it's not some messy patchwork of different rules for different people. No, it's a single set of core principles that gets everyone on the same page, from the student who's just learning the ropes, to the executive making million-dollar purchasing decisions, to the nurse making those critical choices right there at the bedside.
So, they call this AI governance. But look closely at the definition here. Notice the perspective. This isn't about managing tech just for the sake of managing tech. No, it's about protecting the absolute core values of nursing, the quality of care, and that essential trust between a patient and a caregiver.
And what's so smart about this process is how it just works everywhere. For a teacher, set expectations means putting clear AI rules right in the syllabus. For a hospital leader, ensure oversight gets baked right into hospital policy. And for a nurse on the floor, define accountability is just part of their everyday work. No matter where you are, these 4 steps make sure that human judgment never, ever gets lost in the shuffle.
Okay, and this brings us to what is honestly the most crucial part of this entire framework. Where exactly do you draw the line between a machine giving support and a human taking responsibility? The whole system is built on what they call the human-in-the-loop model.
This slide right here, this is the bright red line. It's the one rule to rule them all. The single sentence is the ultimate backstop. It makes it perfectly clear. AI can be a tool, sure, just like a stethoscope is a tool, but it can never, ever do the things that require a professional license and human judgment.
So what does being in the loop actually look like in practice? Well, the model is super clear. First, the nurse reviews whatever the AI spits out. Then they validate it against their own assessment and their own clinical smarts. And then they make a conscious decision. Am I going to use this, tweak it, or just toss it out completely? And no matter what they choose, they're the one who remains accountable. The AI can inform, but the nurse always decides.
But, this brings up a really human problem, doesn't it? The risk of, trusting the machine too much. What happens when a tool is right 99% of the time? It gets really tempting to just go with it, especially when you're under pressure. And the nursing guidelines tackle this subtle but really critical danger head-on.
And the instruction on what to do, it's completely unambiguous. There's zero gray area here. If the machine says one thing, but your own professional assessment of the actual human being in front of you says something else, you pause, you reassess the patient, and you trust your clinical judgment, period. When in doubt, the patient, not the algorithm, always comes first.
Okay, so let's get practical. How does all this high-level policy stuff actually translate into everyday guidelines for using these tools safely?
And this slide just lays it out perfectly. On the left, you've got safe use. Think of it like a helpful assistant, something to help you draft a note that you're going to edit anyway, or to summarize a complicated policy. But on the right, that's unsafe use. That's delegation. That's accepting a recommendation without checking it or letting the AI diagnose a patient. See the difference? One enhances the nurse, the other tries to replace them.
Now, what about the people actually buying this tech? For them, there's basically a checklist of giant red flags to watch out for. A huge one is a black box algorithm, where the vendor can't even tell you how it came up with an answer. Or any vendor who has the nerve to claim their tool can replace clinical judgment.
Oh, and if nurses weren't involved in building it from the ground up, that's another major warning sign.
So when it all comes down to it, before a hospital buys a new AI tool or a nurse even thinks about using one, there's a final check. And it's basically a simple but really powerful set of questions that you have to be able to answer with a confident yes.
First up, is this thing going to make our nurses better thinkers, or is it just going to do the thinking for them? The goal has to be to empower the professional, not diminish them. That's the first gate you have to get through.
Next, you have to ask, is it crystal clear who's responsible here? Who owns the outcome? When a decision gets made, does everyone in the room know exactly where the buck stops? Because if there's any confusion, that tool is not ready for patient care. In a crisis, you need total clarity on responsibility. And finally, is there an emergency brake? A big red stop button. Look, technology is never perfect. If something goes wrong, if some unintended harm starts showing up, is there a clear and immediate way to hit the brakes? Without that safety net, you're just flying blind. It's non-negotiable.
And all of this brings us back to the big idea, the core philosophy that's woven into every single piece of guidance for every nurse, from the classroom to the boardroom. It's a fundamental statement about the real relationship between technology and healthcare. So yeah, the bottom line is this statement right here, or some version of it, is the foundation for everything. It's the final word. It means technology has to adapt to the rigorous standards of nursing practice, not the other way around.
You know, this quote from the Educator's Toolkit really says it all, doesn't it? This whole effort, it's not some frantic tech race to keep up with Silicon Valley. It's a deliberate, thoughtful evolution in how we train and support our nurses. It's all designed to make sure that no matter how sophisticated the tools get, the nurse's ability to think, to judge, and to lead, that always remains at the very heart of patient care.